Good day, everyone. Welcome to Gender and Society's first chapter entitled Understanding Gender and Sexuality as a Social Reality. In this chapter, we are going to be talking about the concept of sex, gender, and sexuality. Our objectives for this chapter includes defining sex, gender, sexuality, and other related concepts. Second is to differentiate sex from gender. Third is discussing the implications of these differences. And lastly, to be able to recognize one's sexuality and sexual diversity. Now, our outline would include the introduction of this chapter. Second is the definition of sex, intersex, and gender. Third is the difference between what is sex from gender. Fourth is the meanings of heteronormativity, transgender, sexual orientation, and including other types. And the fifth one is finally recognizing sexual diversity. So in your point of view, what does it mean to be a male or a female, to be feminine or masculine, or to be a man or woman? So let us trace our journey from the moment we were born and go back to the journey we humans have across the lifespan. First thing we need to understand is the complexities of defining and differentiating sex, gender, and sexuality. So having a clear grasp of these concepts is crucial since we will be talking about these terms over and over again in our succeeding discussions. Likewise, there are nuances in the meaning of these terms which have an implication on at which context we can appropriately use them. Moreover, as we start our discussion of gender and sexuality as social realities, we also want to understand how a person's gender is expressed from birth to adulthood. Our ultimate goal is to foster understanding of the diversity of how humans experience and express their sexuality. Now, what is sex? So the definition of sex right here is that it is the biological attributes that makes up a person's identity if that person is a female or a male. Okay, so sex is also assigned at birth. Okay, so the first definition of sex right here is the biological dimension of one's gender and sexuality. Second is sex is biological or physical. Okay, so we also have here two definitions of sexual characteristics: our primary sexual characteristics and our secondary sexual characteristics. Now, what are the difference between the two? Our primary sexual characteristics would include our physical appearance that would immediately tell if we are a male or a female. Okay, so an example for the primary sexual characteristics would include having a vagina that signifies that you are a female. If this person has a penis, then it would signify that this person is a man. Okay, so that is the physical or the primary sexual characteristics of a person. Now we can go to the secondary sexual characteristics of a person, which somehow also has a connection with the biological sex of a person, which hormones and chromosomes plays a vital role of identifying the person if he or she is a male or female. The third definition of sex is identity based on sexual anatomy and physiology. So the fourth definition of sex is that it is determined by examining the genitals. So this definition right here also belongs to the primary sexual characteristics of a person, where we could see immediately the physiological or the physical anatomy of a person that would immediately tell if that person is a male or a female. So this physical characteristics are often assigned at birth. Penis and testicles belong to the male or the males, and the vagina belong to the females. But there are cases of difficulty in determining one's sex based only on genitals. Now, these people are what we call as the intersex. Before we dive into the topic of intersex, let us first classify what makes up a normal male or female. So, we have these determinants on identifying the sex of a person. Now, first we have is the chromosomes. So, a normal male would have an X and Y chromosome, while a normal female have a double X chromosome. For the second determinant is the gonads. So, males have their testes, while females we have our ovaries. For the third determinant of sex is the hormones. So, the male's dominant hormone is the testosterone, while the female's dominant hormone is the estrogen. It is important to note also that both testosterone and estrogen are present inside a person's body. It's just that a male's dominant hormone is the testosterone and less on the estrogen, while females have more estrogen and less testosterone. The fourth determinant of sex is the internal reproductive structures of a person. So namely, male has the Wolffian ducts, while female have the Mullerian ducts. Now, where can you find these ducts? So during the fetal stages of a person, you can observe this Wolffian ducts and Mullerian ducts. If that fetus is a male, then you can observe inside his reproductive organs the Wolffian ducts. Now, what is the Wolffian ducts? So if these Wolffian ducts would mature, if the baby or if the fetus would become a baby na, then this Wolffian ducts would serve as the vas deferens of a male. Now, what is the vas deferens? What is the purpose of it? So, the vas deferens, diri moagi si seminal fluid from the testis padulong sa gawas. Okay? Now, the Mullerian duct system, same goes sa female babies, no? Sa female fetuses. If the fetus would become a baby, the Mullerian duct system of the baby would also mature. So, the Mullerian ducts would later turn out to become the fallopian tube of the baby, or for the female baby. Okay? And the fifth and last determinant of sex is the external sex structures. From the word itself, external, we would be able to identify a person's sex based on their external characteristics. So for the male, they have their penis and their scrotal sac, while for the females, we have our clitoris and vagina. So, what is intersex? Since we've already mentioned about those 5 determinants of a person's sex, now, how can we relate this to intersex? Now, those 5 determinants of sex might not always be consistent. Okay? So, here we have intersex. Intersex is also synonymous to hermaphroditism, or a person having an ambiguous genitalia. Okay, so in around 23 to 10,000 births, the 5 definitions of sex are not consistent, resulting in what is referred to as an intersex birth. Okay, so what causes intersex? Intersex can be caused by chromosomal level inconsistencies or because of hormonal level inconsistencies. So let us first discuss what is a chromosomal level inconsistencies. So back on the previous slide, we have made mention about what we deem to be a normal classification of what constitutes as a normal male or female. So a normal male would have an X and Y chromosome, while the female contains a double X chromosome. Now, what chromosome does an intersex person have? Okay, so there are different cases of intersex on a chromosomal level. So the first type of chromosomal inconsistency is a Turner syndrome, or an intersex containing only one X chromosome. Nothing more, nothing less. Okay, so how does this happen? So it is a given that an egg cell of a mother would always contain a single X chromosome. And depende na dayon na sa unsay maka-fertilize na sperm cell ni Papa, because each sperm cell would contain one chromosome only to pair with the chromosome of the egg cell. Okay? But some sperm cell are somehow defective. Some sperm cell would contain no chromosome at all. So, if this sperm cell who does not contain any chromosome and mauni mo fertilize atong egg cell ni mama that contains an X chromosome, then therefore, mahimo siya og bata. Yes, it would still fertilize, but it would later turn out that that baby would experience or would have the Turner syndrome. Okay, so unsa may gender or unsa may sex aning person who is suffering from Turner syndrome? Because a person or this person who is suffering from Turner syndrome only contains one X chromosome, then this person who is suffering from this syndrome is a female because of the presence of the X chromosome. Okay? So this person appears to be a female, but it lacks ovaries. It possesses some external female characteristics. Now, why does she lack ovaries? Because of the lacking X chromosome. Kulang siya of another X chromosome. Okay, so this condition would occur in about 4 to 10,000 live births. So, which means that it is unique or it is rare. So in this slide, you can see the anatomy of a child who has a Turner syndrome. So the second type of intersex is what we call as a Klinefelter syndrome, or a person having an XXY chromosome, which again is not normal. Okay, so this guy or this person appears to be a guy or a man because of the presence of a Y chromosome. But since there is a presence of an extra X chromosome, it means that there is also an abnormality about his physical characteristics. Okay, so this syndrome occurs in roughly 9 to 10,000 live births. So a person suffering from Klinefelter syndrome will have no interest in sex because of its absence of its testosterone. So a person suffering from Klinefelter syndrome is again, no, he is a male by nature, but because of the presence of another X chromosome, it means that that person or this male person would also contain a physical appearance same as of women. Okay, so a person born with this chromosomal characteristic has the height of a normal male with long legs and absent or weak sex drive, and also effeminized hips, some breast development, and a small penis and testes, because again of the extra X chromosome, which stops the development of male structures, resulting in sterility. Contrary to the Klinefelter syndrome, we also have another type of intersex, which is the Jacob syndrome, which contains one X chromosome and double Y chromosome, which occurs in about 1 to 2,000 live births. So it is also a rare condition. So this is a person born with this chromosomal characteristic, is an anatomical male with no physical abnormalities except for unusual height. Okay? The extra Y chromosome does not result in a person having more androgens than an XY male. Such person appears to be able to reproduce successfully and rarely come to the attention of investigators except through large-scale screening of newborns. Now, there are also some of indicators that would immediately tell that a person or a child is suffering from Jacob syndrome. So, this child might appear to be taller than normal males. They may have speech impediments. They might have weaker muscles, delayed puberty, aggression, but most importantly, they have normal appearance. For adult men who has the Jacob syndrome, they might suffer from hypotonia or loss of muscle mass, involuntary muscle movements, and these men might have taller than average height and larger head dimensions. Some would have lower testosterone levels, and some might suffer from infertility. The fourth type of intersex is what we call as triple X syndrome, triple X, or trisomy X, which is same as the Jacob syndrome, occurs roughly in 1 to 2,000 live births. So people born with these chromosomal characteristics are anatomically female since, of course, the presence of 3 consistent chromosomes, and might show visible signs of abnormality. Although they tend to be taller than average females, they might have a slight higher incidence of learning disorders. So, symptoms and signs of triple X syndrome would include, for children, they might have a delayed motor development, might have low IQ, also delayed speech, might have ADHD, and sometimes might even experience abdominal pain. The fifth type is the adrenogenital syndrome, or AGS, or the congenital adrenal hyperplasia, or CAH. So in this scenario, or in this case, a double X fetus receives an excessive amount of androgens, meaning a female baby receives an excessive amount of androgens. Now what will happen? Untreated females with AGS have normally functioning ovaries and normal internal female sexual organs, but may have a masculinized external appearance. This can vary from a slightly enlarged clitoris to a nearly normal-sized penis with an empty scrotum. But if treated with cortisol from birth on, these females will have a later menarche than normal, but will still be able to conceive, lactate, and deliver babies normally. Now let us go to the hormonal inconsistencies that can cause a person to become intersex. First is AIS, or androgen insensitivity syndrome. But before we dive into the definition of this type of intersex, let us first discuss what is androgen. So androgen is a hormone which is crucial for male sexual and reproductive function. They are also responsible for the development of secondary sexual characteristics in men, such as hair growth in different areas of the body and also the change of their voice. But what happens if a chromosomally male child is insensitive to androgen? Then tendencies are their genitalia would appear to be ambiguous, or that it looks more like a clitoris than of a penis. So AIS is not curable by administering androgens because their receptors inside their body cannot absorb it, since again they are insensitive to that hormone. At puberty, AIS people or persons develop breasts and a feminine body shape and sometimes identify as females. So the results in female genitalia including a shallow but non-functional vagina. They are raised as girls, they assume a female gender identity and thrive as females. So this is an example of the anatomical structure of a person who is suffering from AIS. So there are tendencies that they are raised as females, but when they try to conceive babies, magwonder na rin sila, why are they not pregnant? Why are some women, they got their periods already, while they still don't have theirs? The tendencies are when they went to the doctor, they had their checkup, they figured out that they are not females at all. They are chromosomally males, but they are raised as women because of this misconception that their genitalia appears to be female. Then tendencies are they're also raised as females, but the truth is in their chromosomes they are men, or they are males. So complete androgen insensitivity syndrome, they are phenotypically female. Symptoms do not appear until puberty. They have absent menses, and their external genitalia is normal. Vaginal depth is short. They do not have ovaries, but they have atrophic testes. They have slightly longer limbs and larger hands and feet. They have minimal or no acne. They also have larger teeth, well-developed breasts. They have greater incidence of meibomian gland dysfunction or dry eye syndromes and light sensitivity. So fetally androgenized females is another type of intersex now caused by hormonal inconsistencies. So these females are heavily exposed to androgens. Now what happens if this female or chromosomally female baby is exposed to excessive amount of androgens? So at birth, they appear to be male, okay, because their genitals are also exposed to these hormones. Now, corrected by minor surgery, most still reject a female gender identity, as some would still continue to assume a male gender identity and behavior. So this is a contradictory to the AIS people, or to the AIS male, who are chromosomally male but they are raised as being females. For the fetally androgenized females, some of them are assumed to be male at birth because of these of their genitalia, no? And some of these fetally androgenized females would assume male gender identity and their behavior as well. Another type of hormonal inconsistency that would produce an intersex for a temporary amount of time is the DHT lacking males, or males who cannot produce crucial DHT. Now, what is DHT? DHT, or dihydrotestosterone, is also a hormone with powerful androgenic actions, causes the body to mature during puberty, and is responsible for many of the physical characteristics associated with adult males. Now, the result of this men who are DHT deprived is that their genitalia would appear to be like of the females, at least initially. So they are typically raised as girls, then they suddenly sprout into males at puberty. Also, there is this one study that 16 out of 18 people cast off their female gender identity and happily assumed male sex roles. Because we've talked about some of the cases of the intersex people assuming gender roles that may or may not be congruent to the sex determined by their chromosomes, let us now go to the concept of gender. Now, gender refers to the distinctive qualities of men and women, the masculinity and the femininity of an individual that are culturally created. So there is this distinct difference between what is sex from gender. Sex is assigned at birth, while gender is a learned behavior taught to us by our family, peers, school, media, our known culture in general. Gender is a state of being male or a female in our society, so they are typically used with reference to social and cultural differences rather than on the biological ones. Gender identifies the characteristics of social behavior of men and women and the relationship between them. Gender roles are not fixed and may change over time. So what might be an unacceptable gender role before may be acceptable now. An example of this is the Maria Clara concept of the Filipino women. So this is the idea that women should stay indoors, serve their husbands, and tend to the children's needs, while the men's gender roles are assumed to be working outside the household, and to be the ones to be educated. But during these times, gender roles such as having the right to be educated or having the right to apply for jobs have become more inclusive, which solidifies the claim that gender roles change over time. Also, gender varies from culture to culture. So, what we might know as feminine or masculine behavior may not be the practice of other cultures, coming to a conclusion that sex is universal while gender varies from culture to culture since it is a learned or an acquired behavior. Now let us magnify the difference between sex and gender so that we could understand the differences of these terms even more. First is sex makes one a male or a female by able to determine the determinants of sex, which we discussed earlier before, while gender is to be able to identify what is a masculine or a feminine behavior. Second is sex is biologically determined, while gender is socially determined and culturally defined. Third is sex refers to the physical characteristics of a person, while gender refers to a learned behavior. Okay, so this is a table of the distinctions between sex and gender. So for the sex, female, and for the gender, we have the feminine behavior. For the males, or for the sex, we have the males. For the behavior, for the males, for the gender is masculine. So sex tends to be more on the physical aspect of a person, while gender is socially defined, socially and culturally defined. For the sex is universal, while gender is cultural. Sex is congenital, while gender is a learned behavior. Sex is unchanging or permanent, while gender changes over time, since it is a behavior, not a learned behavior. Sex is unvarying, while gender is varying within a culture or among other cultures. There are common manifestations of gender from the mainstream culture. These manifestations would include color. So girls are assigned with the color pink to match their femininity, while boys are assigned with the color blue to assign their masculinity. For clothing, tuxedos are expected to be worn by men and gowns for women. For the behavior, girls are expected to be prim and proper, while the boys' behavior in society are accepted more if they play rough games. For the social roles, women are expected to do the nurturing tasks, while men are expected to be involved more on working in industries occupying higher-ranking positions. And lastly, the characteristics or traits. Women are seen to be nurturing to the needs of everyone, while men are seen to be consistently physically and mentally strong. So to a social definition, we have these different stereotypes or assumptions about the behaviors of male and female in our mainstream society. So male are perceived to be logical, the leader or the achiever. They are sexually aggressive, they are independent, and can do anything, anytime, and anywhere. For the female, our definition of feminine characteristics in our mainstream culture is that females are emotional. Females are the followers or the supporters of men. They should be, or they are, sexually submissive. Women should be dependent to men, and female are perceived to be incompetent. Now, we all know that this is not all the time true. These are just assumptions or stereotypes that are being imposed by our mainstream society. But again, these gender roles varies from culture to culture. So the social definition of males and females in our society might not necessarily be the practice of other nations. We have this what we call as heteronormativity, or this is the belief that heterosexuality is the preferred or normal mode of sexual orientation. So anyone who deviates from heteronormativity is perceived to be different. Okay, so this is where we define what is normal from strange. So our gender in our mainstream society should be heteronormative to our sex assigned at birth. But this is not always the case, because there are those people who do not accept the culture standards from our culture of what is considered to be masculine or feminine. An example for this is Kristen Stewart. She prefers to wear clothes that are designed for men, and on the other hand, for homosexuals, who prefer to wear clothing that are not congruent to their assigned sex at birth. So it is a natural variation of human gender expression of who they truly are inside. Okay, so social and cultural practices change through time as well. So before, women weren't allowed to wear pants, and now, as you can see, women can already choose to wear whatever we wanted, and the same goes for men too. Now, what is gender identity? So gender identity is the aspect of gender referring to the sense of who we are. Okay, so this is how you identify yourself as who you truly are, based on how you experience yourself. So say for example, if you are a man and you are attracted to women, then you would identify yourself as you are a man. That is your gender. And also, if you're a woman who is attracted to men, then you would also identify your gender as a woman. Now, there are also people who are homosexuals, or those people who are attracted to with the same sex as theirs. Then they can identify their gender as gay or lesbians. Now, there is also a group of people who classifies as they are not attracted to anyone at all. Therefore, they consider themselves as a gender. Now, another term is transgender. So, this is a case when a person's biological sex does not align with one's gender identity. Okay, so an example for this is a male who does not feel comfortable identifying as a man. So therefore, they change their clothing into the clothing of a woman, in which kung aha sila mas comfortable. Same goes for females who are not comfortable in identifying themselves as women, and therefore they change their expression of themselves as a man. Okay, so a transgender man. Now, oftentimes we might associate the word transgender as those people who went surgery, to change their genitalia into the opposite one. But tendencies are these transgender people may undergo gender reassignment surgery, but we actually have another terminology for that. Okay, so this is what we call as the transsexual people. Okay, transgender people may or may not undergo reassignment surgery, but those people who underwent such surgery are called as transsexuals. Another term is sexual orientation, or the aspect of gender that pertains to our emotional and sexual attraction to a person. So, we could identify ourselves in three forms. So other people would determine as heterosexuals, or people who are straight or attracted to the opposite sex. Some people are also homosexual, so they are attracted to the people of the same sex as theirs. And we also have this people who are bisexuals, so people who are attracted to both sexes, both male or female. Now we also have another two categories of sexual orientation. The fourth one is the pansexual, or the people who are attracted to all kinds of gender, no? Be it bisexual or homosexual or heterosexual. From the word itself, pan, or meaning all, a pansexual person is attracted to everyone regardless of your gender identity. Now we also have this sexual orientation called as asexual, or person who is not attracted to anyone at all. Have this gender-bread person as a basis in looking at different spectrums of a person's identity. For gender identity, we already have discussed it earlier that gender identity is how you would identify your gender based on how you experience yourself. So, a person's gender identity can be a woman, a genderqueer, or a person who does not identify to or belong to a specific gender, or your gender identity would be of a man. For gender expressions, this is how you express yourself based on your gender identity. One can behave in a feminine manner or in an androgynous behavior, no? So an androgynous behavior would mean that an individual who has both feminine and masculine traits and or behave in a masculine way. For the next one, the biological sex, a person can only be in three sexes: females, an intersex, or a person having an ambiguous genitalia, and males. For sexual orientation, a person can be a heterosexual person. A person also can be a bisexual person, or a person who is attracted to both men and women. And lastly is the homosexual, or a person attracted to the same sex as theirs. Recognizing diversity. Nature and nurture play a complex role in shaping our sexual orientation. Now, our sexual orientation is also how we identify ourselves based on who we are attracted to. Now, this is something that is beyond our control. We do not choose who we are going to be attracted to. So there are numerous studies that would suggest that there are biological factors that would contribute as to why a person's sexual orientation is not uniform as with everybody's. Homosexuality and heterosexuality are part of human sexuality and a large part of human experience. Identifying as heterosexual, homosexual, or bisexual is a deeply personal process, so maybe it might be difficult to come out for some other people. Some come early in adolescence, depending on how nurturing and open their environments are, but some others may take time to understand and discover themselves. According to the Psychological Association of the Philippines, we can only tell if the person is gay, lesbian, or bisexual if they share with us their experiences and feelings of attraction towards them. In other words, we should not immediately place our assumption towards a person based on their behavior alone. Some men behave in a feminine manner, some women behave in a masculine manner, but that doesn't necessarily mean that they are immediately homosexuals. Unfortunately, we are still living in a society where being lesbian or gay is heavily frowned upon by traditional people. So putting up our assumptions without confirmation would only do these people more harm than good. Now, to recognize diversity, one must possess an open mind and a positive attitude to people who have or has not come out of the closet yet. This can be done in an environment where these people are not or do not feel judged or discriminated upon. Being able to recognize and accept people for who they truly are is one step in attaining societal development and for the mental and emotional growth of the individual as well. So for your activity, please refer to the guidelines inside your Google class. That ends our topic for lesson 1. Thank you for listening and expect more videos after this. See you soon and God bless.